Thank you for joining us. We have two great folks from the Agape Network, been around for decades. Right? So we have Samuel Hernandez and Claudio Perez here. Thank you very much, gentlemen, for being here. So, big picture before people escape. Tell us about Agape and the services you provide.
So Agape is a nationally accredited national model of care. We are a faith-based rehabilitation program where we provide mental health and substance abuse resources to women residentially. We have a 131-bed facility, and we have an outpatient program with close to 2,000 patients in our monthly care.
That is amazing. That's pretty big.
Oh, yeah.
So of all the jobs in the world, he comes from the family that's so you're there, you can't escape, all right? But you chose to work for Agape. What was the calling?
Oh, absolutely. It's the most meaningful work because it's holistic care in healthcare, in substance abuse, mental health. And the beautiful part about it is that we are holistic in our approach, integrated with faith, evidence-based practices, and then we see total transformations. So when you compare that to making widgets or anything else, I was a real estate investor many, many years ago, invested in a lot of property. And for the last 30 years, I've been serving here at Agape, first as a board member, vice chair, and then president or CEO.
And you're just getting going.
Yeah. Oh, yeah. We're excited. We just finished building a tremendous expansion, a $32 million expansion, and we're just very excited about what's happening and the services we're expanding to the community.
So you're in the legacy in this family of providing care. So tell us what it was like growing up and having all of this surrounding you.
It was truly just so impactful to see just throughout the years so many women's lives just be completely changed and restored. I mean, some of these women come in dead, just defeated by drug abuse and mental health, and just given up on by society. Just to see so many people just come in and help, from board members to people in the community to our therapists, our psychiatrists, just pouring into these women and just giving them hope that they lost in the streets.
So here's one of the things I've heard several times: faith-based and hope, right? And mercy too and grace.
That's right.
That seems to be a theme, and a lot of the not-for-profits are out there that be able to call in this bigger picture. Yeah. So tell us how that drives you and the way you try to keep the business organized.
Well, the beautiful thing is that we're non-denominational, non-sectarian. So what we believe is the agape love of God, and that's his father who founded Agape over 40-something years ago, believed in having the unconditional love of God be understood and received as a free gift. Meaning agape is a Koine Greek term that says it's an unconditional love. There's other forms of agape. There's brotherly love. Philadelphia is a brotherly love. Eros it's erotic type love. But agape love is an unconditional love. And when these women, children, individuals that are lost without hope, they have been abused and they're vulnerable. When they understand that God loves them just the way they are, that changes lives.
And we understand, I went to nursing school a long time ago, and I was a nurse for a while, and I worked in one of the psychiatric centers. And you realize that so often people, they just want to be heard. They want somebody holding their hand, and they don't want to be alone. So tell us how some of those things, and plus other things, help them get better in your facilities.
I would say a huge part of it is the faith component. I mean, we, aside from psychiatry and therapy and case management, we have a chaplaincy program where we have 2 dedicated chaplains, almost 9 to 5 every single day, dedicated to pouring into their lives spiritually, which involves Bible studies, prayer, and any kind of support as long as that. But I think that's one of the biggest take homes that these women have when they leave the program.
And let's talk about, you have a client, clients that come in however they get there, and they're in your program. Give us a 6 months stay or effort, and then a little bit longer than that. How do they get through it, and what are some of the things that are involved in it?
Yeah, and we have a significant size program. It's over 132 beds. We have over 160 staff. Again, like he said, full psychiatry, nursing staff, everything else. Now, they can come through jail diversion programs that we have, through crisis stabilization units, hospitals, law enforcement. Many systems in our community refer to us. Once they come to us, we take custody of the mother and the child so that they don't get placed in foster care. We put them through treatment together. We have an incredible, it's a nationally renowned evidence-based practice integrated care system. So we have a early education center in our facility. We have transitional housing from the most acute level of care, then transitioning into housing in our own facility. It's a 6-acre campus where we have all these services coming together.
Just for somebody that missed part about it, so it would be like, if you will, elementary school, junior high school, or whatever they call it now, senior high, college.
That's right.
So they move forward through the process.
Right, all the way out into our outpatient services. So we continue to support them in their recovery and getting connected to the community in a place of worship. And again, we have Catholic, Presbyterian, Baptist, Jewish, whatever their needs are. We have a big part of the chaplaincy programs in all the jails of Dade County. That's South Florida Jail Ministries and Agape Network. We have chaplains in the Catholic Archdiocese. All of them are involved with us, providing care in the jails and in our facilities.
And as I mentioned earlier, I didn't realize until recently that if there's an unsheltered person and he has zero, and somebody can get them into one of the systems, whether it's yours, somebody else, there's help for them here in Miami-Dade County. Somewhere, somebody can help them. But there's some folks that don't really want help. So what is it, if they get recommended to you, however that happens, and your intake person sits down with them and they go, I don't want it. I enjoy being somewhere else out on the street. What's the typical conversation that occurs before they get up and walk out, or before they say, all right, I'll try it?
So take that with outreach, share with the outreach programs. And
I think it's a matter of just, I feel like at any time that someone wants to go through a program like that, they have to have some motivation in them to get out of the situation that they're in. And I think the most we can do is just tell them how this program has changed other people's lives and give them a taste of what it could be if they get off drugs, or if we can work on their mental health issues. But ultimately, I think that it has to come from within, and I think we do a good job with our testimonials and showing how the program has impacted so many people's lives.
So how do you move from somebody that has lost hope? They're done, right? They're literally sleeping on the streets, all right? Their whole home is a cart, all right, that people are always trying to take from them. And the police, they're pretty gentle at this point, all right? But people turn the other way at the stoplight. And I've been both ways. We all have where you want to help, and the other time you just don't look up because you don't want to meet them. How do they get from that point to where it's figuring out how to survive to, well, I want to go where there's a roof over my head? You've been doing this or heard about these stories for a long time. Well, actually, between the two of you, probably 70 or 80 years.
Yeah.
Right? Your entire life, and you half. Right?
Well, the beautiful thing, Michael, is that, listen, they need a vision. They gotta see themselves where they could be and should be. That's having a vision. And the important thing is that you go to where they're at. You understand where they're at, where they've been, and then share with them where they could be. And this is where you need to have the services available that takes them through every step. Bring them in. We have outpatient services if they don't want to come in to be in a residential program. We can step them up or down according to their needs. But the first thing is for them to understand, or to give them something that they can grasp, that they can see how they can be much more a productive citizen, that they're loved, and that they have something to offer. And when they understand that, when they can see that, when they understand that they're loved unconditionally, that changes things.
Let's talk about the mental health crisis that seems to be going on all the time. You gentlemen are acutely familiar with it. And we know that the county just finally approved the opening of this 80-bed hospital, which in itself is part of the solution. And you figure out, I don't know how many patients that is for a year, and it's not a big number, but thank you very much, County Commission and the Mayor, for doing that. And I understand a lot of the prisoners that are over there are going to move over there. But bigger picture is that the county, I think, is paying a little more attention to it. When my brother Grant went a couple Christmases ago to Under the Bridges downtown to give away some tennis shoes, he came back. He was beside himself. When you see one at a time, that's one thing. But when you see 5 or 10 or 15 people like you see in the movies, it's really crushing. You must have seen this 20 years ago. I don't know how old you are, but
26.
Right. When you were a little kid, did you see that?
Oh yeah.
All right. So what did it mean to you, and what did it do for you and to you?
Just it's super crushing to see just so many people affected by it, and it's not. I would say like the whole mental health crisis thing is not a Republican or Democrat thing. It affects everybody, and it's just the lengths that it goes and the way that it just is so destructive. And if it goes completely untreated, it's just so defeating to somebody. So to have a county commission, a state that cares about these issues, and programs like Agape and other programs around the state, it's a very nice thing to have available for the population over here.
And a lot of the folks that are unsheltered, they have. We generically call them mental health issues. They could be schizophrenic or not. They could just be a lot of problems, maybe it's drug or alcohol, or just no money, right? And it winds up like that. But just by virtue that you're out on the street exacerbates everything. So when you're watching some of these clients starting to get better, what's it like for you? You've been doing this for 30 years plus, been involved with it. What's it like for you?
Oh my goodness, that makes all the difference in the world. Super exciting, because they become excited. They become not takers, but givers. These mothers and adults, male, female, but these mothers that have been so beat up by their circumstances now understand that they can give back. They are the best at telling others. We're all beggars telling other beggars where we found bread, but they become excited because now they're going to be the mother. It's almost an answer to prayer to their children and other loved ones that have been praying for them. And when they get excited and they get the proper support and a continuum of care back into the community with the services they need, oh my goodness, they are incredible givers, not takers of the community.
So, and what I'm hearing, you're just not treating the client. It's their whole family unit, however large or however small it is. So when somebody has a mental health crisis, they're not alone. No. Right? And Mayor Alex Pinellas years ago had a brother that was unfortunately had mental illness. And he was out on the street. And Alex spoke in public meetings. He says, Michael, I had the bully pulpit, and I didn't know what to do. And he is open about that. He says, I wish there was more I could have done. And that was probably 15 years ago, I think. But the meeting was 5 or 6 years ago. And he was so open about it. And that's where the freedom comes in, to where you can openly discuss this. Yeah. So let's just, again, do a little bit of the journey. They wind up at your facility. Tell us about the steps, because maybe somebody's going to watch this and say, we're going to go get Uncle Joe. He's out on the street. Maybe we can get him in. So how would they get from wherever they are to part of your facility, and what would the first few days look like?
So residentially, it would the process would be, we have a bunch of liaisons. We have about 15 or so liaisons right now that are coordinating referrals. So from the hospitals, they process referrals, but I guess in that sense, more or less, the person would have to be willing to fill out a referral. We'd receive the referral. From then, our intake team will process a psychosocial, and we will just evaluate them. From then, we'll intake them into the facility, and from then, it's therapy, psychiatry, case management. The whole process internally, and then leaving out onto kind of like leaving the program.
So if somebody was at Jackson Memorial Hospital, just picking on them, right? They're over there and they don't have much, and so a social worker goes in and says, okay, your medical problem is gone and you're going to go home tomorrow. And we know where home might be. Is that the first step? Is it that person that has that contact, or is there something else that might happen before that?
Well, there's many ways that they can get to us. Now, that's in residential. If they're in outpatient, we're one of the few that go in-home on site. So we send a care team model, a care team that includes therapists and peers, whatever they need to the home. So we evaluate the child, the whoever it is, and it doesn't matter if they're funded or unfunded, with benefits or no benefits or insurance, and we evaluate their home and provide treatment according to the need of the family. So we may be treating an uncle or a grandma, whoever it is in the home. Now they can come to us as well, but there's a lot of barriers with some of these vulnerable populations to get to your facility and to get to all the different types of services.
If somebody's out on the street, do you have a mobile team that can go out? Somebody calls, hey, there's a guy that's sitting out on the corner and he's been there for 3 days.
We're not a crisis unit, a mobile unit, but they refer to us. Now we send, after we get the referral, we send our team to them, and it could be, again, like I said, in home, on site, schools, wherever their needs are, we can send them there. But we're not the crisis. We're not the first line of defense. That's law enforcement, and then you have the mobile crisis units.
So let's talk about drug addiction and the clients that you have, whatever the drug of choice is. So getting clean, if you will, it must be very difficult. And I've been blessed that I got other stuff. It's not drugs or alcohol, whatever it is. And so I consider myself lucky. But how do you move somebody from needing some drug to like just wanting it, and then it sort of drifts away? Tell us about that process for them.
Well, the process is just, I could imagine how excruciating it could be to be so, in bondage to a substance and just have no answer to how to get off of it. And, some people never get off the drugs and, get into really, really horrible positions, but it's just so beautiful. Our psychiatrist's main goal are to get these women off these drugs, and they want to do it by eliminating as much medication as possible, just having them in a place where they can be medicated without overdoing medication or adding new medication to their lifestyle. But the detox is a huge part. Once they get past the detox, I think it's pretty smooth sailing. If they're committed to the program, I think that their chances of getting off the drugs go up significantly.
So they might go from where drugs are accepted to say, no, you can't do that anymore. That's on the other side of the door. So that means whatever friends, associates they have, that's changed.
Well, we make sure that the first 30 days and so forth, they have a barrier against that influence that's coming toward them. We also help them develop a treatment plan, so they're involved in doing that with their therapist and treatment team. Once they develop that, they get that vision. They understand we're going to work on this, on getting you the jobs. We're going to work on getting you IDs if they don't have any, and everything else they need to be successful. Once they envision that, and they know that they have the support they need, now it's just a matter of time. And it's difficult because the physical part of their body and of the treatment is hard on them because they're longing to go back.
Yes. Can we put up their website address? So if somebody needs some help and they want to find out if they need some help, or whether they want to give some money, and I'm sure you have a lot of contributors, and we have a lot of rich people in Miami-Dade County, so get with it, guys, all right? And tell us about how Agape gets funded and to have this significant operation for 40 plus years.
Yeah, we're blessed because we have a sustainable business model where we bill fee for services, value-based care. So wherever there's insurance, when there's no insurance, we have our contracts for over 40 years with the Department of Children and Families. That includes the management entity now, which is Thriving Mind. We have great partnership with them, but we have a $20 million a year budget. So out of that, only about 3% is donations, and that is for the faith component that we use, and that we use our own funds for, which comes from donations. But besides that, we have a great network of faith community of other resources that we make available for our system of care.
You've been whether you wanted to or not. When you were a child, you were really got involved with this, and when you see the progress that's happening in Miami-Dade County, including to the entities that are here, tell us about your process of awareness with that.
It's just I think it's fantastic how invested everybody has come in the past couple of years. I feel like in the last 10 to 15 years, mental health and substance abuse was kind of overlooked as not so important, but just the jump in urgency for this issue. Just politicians from all across the country, the county, the state, have just come together and just made it such an urgent issue.
So, as I mentioned before, I was in the health arena for a while, and I always go look at different insurance policies. I said, let's see what their mental health coverage was. Like, you could break a finger and get more coverage,
Exactly.
right, than you could. It was astonishing how poor that was. Everybody's faking whatever they would say.
Yeah.
That's not so, all right? We know that. And when people are out in the street, they got to know a huge percent of them have real problems. It's not like they just want to be there. Something got them there, right? And so when you mentioned psychiatrists, I don't know, about 6 or 7 times. So let's talk a little bit about being able to talk to somebody, a client, and how that helps improve their outlook.
I think talking about your issues beyond speaking to a friend, just speaking to somebody, a medical professional that you can know that and wholeheartedly that they're not going to judge you. They're not going to go and tell other people that you might know about your personal issues. It's just that confidentiality, I feel like, just births such transparency and just vulnerability for them to just be true to themselves, which is where
we know when you go to the doctor and you talk to what's wrong, instantly most people feel better. They go, this is wonderful. He hadn't done anything, all right, but I'm already feeling better. So when you see that happen down there, and you start to see a little smile eke out of them, what's it like for you to look at the smile on his face?
Yeah, but that's what we live for. And even though we're 60-something% success rate, 70%, we're losing some of the ones that don't and go back. But the ones that do understand and get the support and understand what it feels like to be to have a treatment team that includes all these professionals, and it is amazing what difference they make back in the home with their family. This is really, changing the community. You change it one life at a time. When you change and support these mothers and children back in their lifestyle, going back into the community, it transforms them and the community.
It's right down the street from here. There's a organization that it's a 12-step program. They have over 100 meetings a month.
Wow.
For whatever ails you, they got a program for it. The other night I was leaving, there were at least 75 cars. There are people there. I don't know if that was a medallion night or whatever it was, but I'm seeing it consistently to where there's an issue out there for just about they do overeaters and too much booze, whatever is there.
Yes.
And so we realize that so many folks are either directly or indirectly affected by this.
Yes.
So for every client that you have, there are a whole bunch of other people that are there.
Oh, yeah.
So what's it like when you have one client there and then a month later somebody that knows comes over and another one, you get to meet the other family?
Yeah.
So you're just not treating the one person, it's the whole group. So how do you get everybody stop being mad at Uncle Joe because he was out on the street and because of whatever? So what's that conversation look like?
And the thing that we got to understand too, it is not just a homeless population. Many families, and like he said, it's not Republican, it's not a Democrat issue. It is really a mental state. And that's why we need parity in our insurance companies, in managed care and so forth. There needs to be the same level of value and priority given to health care, primary health care, as it is in behavioral health care. So behavioral health care is an illness that has recovery and an outcome, a positive outcome. So the more we legislate parity in insurance companies, that's going to continue to help reduce the stigma.
So one and good luck with that. I know it's going to be very hard to move that. It's a step at a time. There's a South Miami Children's Clinic that is run by Dr. Tina Carroll Scott. It's a mile from here. 17 years ago, she was a pediatrician working in Bell Harbor. Whole bunch of money, whole bunch of clients. She just said, I'm going to go down to South Miami. I'm going to serve the people that I can help the most. So when we were talking to her, I was talking about the patient. She said, no, the family, Michael. You got to treat the mom and the dad and the sisters or brothers or whoever. So the child is what got them there. But they have that whole thing. And she is so caring that one of her families was evicted. And she went over and got him and put him in a hotel. And there were two twins. One of them had a scholarship to FIU and the other one to MIT. And she was able to keep them. And they were ready to give up, no place to go. And I'm sure you've seen that. I haven't seen too much of that. But when I saw that, I was like, one, I was very sad, but two, that somebody was there. So tell us about the staff that's there and how committed that they are.
Well, we have, in my opinion, some of the best staff in the world. It's just they're so committed to our population. But something that you said that just reminded me so clearly is we have a Mommy and Me program where we have mothers across the county that are using drugs, either pregnant or have a child under the age of 5 years old, that instead of losing their child to the system and having them up for foster care, they're able to keep the child in our care at Agape and not lose them to foster care. So it's just a beautiful thing as keeping the family together. The child doesn't have to grow up in the foster care system, and they can grow up with their mother, and hopefully the mother gets better and they can have a whole family, not separate.
Speaking of moms, beautiful pink hair.
Oh yeah.
So why don't you tell us about what's in here and what, right?
Oh my goodness, you're talking about the expansion that we did?
Yes.
Well, we did it's a 10 building, $32 million expansion. And with the visionary partnership of so many elected officials and, like you said, the mayor and at the state level, even the governor and the senators, and so many that came together and helped us fund Baptist Health Systems. Big supporter there.
Right. Thank you, Baptist.
Oh, yes. Well, their chairman of the board now, Dr. Bill White, is our chairman of the board. He's been the chairman many years. We have the CEO of Baptist Health. He's also our board member, Bill Duquette, the South Miami CEO. We have City National Bank, the CEO's wife. So many that came together. The Munillas, Pedro Munilla and Joseph
He used
Milton.
to be right down the street.
That's right. He's right there. He's a board member. And so is Joseph Milton. Joseph Milton and his wife do tremendous work at
There's a
Agape.
hospital named after them.
That's right. Well, they're very involved. But through the partnership of all these community leaders, we were able to build this $32 million expansion. What's that?
Where is it located?
At 22790 Southwest 112th Avenue. We have 6 acres there, and then we have another 8 acres on Old Cutler Road, about a mile down from there. So we have 2 big facilities there. We have another facility in the north. But with this expansion, that was such an exciting thing because we saw all the communities, the national, Washington, D.C. We had congressmen, unbelievable, from both sides coming together to give us millions and millions of dollars so that we would be able to do this.
Wonderful.
Yeah.
We've got a couple minutes left. And if there was, we're gonna go over by 2 minutes, Leslie. There's Leslie over there. Say hi.
She's awesome.
Okay, there she is. If there was one thing you could do to in the mental health arena, what would we need to stop and what would we need to start? And we're going to ask you afterwards as well.
I think the biggest thing is just coming together, just understanding that this isn't something to be looked at as like a negative thing. It's something that everyone goes through, whether it's not you personally, but your father might, your mother might, your brother might, your cousin might. But it's just, if we can just get past that and understand that this is something that affects everybody, I think more people will be willing to seek health to seek help and to get the care that they need for this. So I think that's what I would say.
Well, we're very excited about what we're doing because you said, what do we need to stop? We need to stop funding this as silos. We need to stop funding substance use disorders separate from mental illness and have different pots of money for children versus adults and outpatient. And what we're doing is we have a multi-million-dollar contract right now with DCF and Thriving Mind that is bringing all those cost centers together under one cost center that is bringing down all those barriers. So we have funding that allows to fund residential, outpatient, substance abuse, mental health, inpatient, outpatient, and this was done by the visionary, strategic initiatives from the governor, the DCF secretary, and now also Aqua's secretary, who was the DCF secretary, Secretary Harris. And they're coming together to start streamlining these funding streams so that we can do value-based care, not just episodic care, but value, whatever that individual needs, where you have the funding to follow them all the way through their treatment process.
So we know people that if they want to get fit, there's a whole bunch of stuff they do, but we know we need to be consistent, go to the gym or walk consistently and be there. And we know what happens when you stop. And so I know that's a problem lots of times, and how you get the people, if they're feeling good, keep doing it. When I worked in the Institute, the people would say, gee, I've been taking my medicine for 3 months. I don't need to take it anymore because I'm feeling really good. And then 3 weeks later, bingo, they're having another episode. So this particular part of the program, what I'd like you both to think about is some people that have helped you along your way in your journey. And whether it's business or personal, I'd like you to think about it. And I'd like to give you an opportunity to thank them. And if you would look right into this camera right over here, this one right here, and you can talk to them. If they've already passed and you still want to talk to them, you can. If you mention by name, that's wonderful as well. So go for it.
Oh boy. Well, I really want to thank our founder, Dr. Hernandez, who had the vision and had the ability to listen to where the need was and then make himself available. And this started 40-something years ago. Then we've had tremendous support. One of them I can think of is Jeanette Rubio, which has been a tremendous support of Agape. Secretary Rubio's wife, for like 10 years she served on our board, and we're just very thankful because she helped start the mental health side of our system of care, which was a tremendous blessing, and so many others that we're thankful for. Our board is an incredible encouragement to us and a support that helps us accomplish what our community needs.
Wonderful. You're on, Sam.
And I guess I would like to say thank you so much to my dad for taking the initiative to start a program like this when there was a time in the 80s where there wasn't any program similar to this helping women that were coming out of jail. And it's just the impact that this has made on lives of women plus families and generations to come from it. I also want to thank the board, all of our board members throughout the years from the 80s up until today that have just made all of this possible. Beyond what we can do, it's definitely not possible without the contributions that they've put and the sacrifices and the time that they've put. So I just want to say thank you so much to everybody that's been a huge part in putting this together.
And when you leave on your way out to the car, think about the other people that have helped you.
Amen.
All right, let's look right over that camera. This is the point where my brother Grant and I remind you that we subscribe to the Disney rule, which is when you hug someone, don't stop until they do. Have a great day. Bye.